Thanks for tuning in to our partner webinar brought to you by the National Association of Nutrition Professionals. This webinar is part of our NANP's partnership program, bringing you the latest information, education, products, and services from the holistic nutrition and wellness space. These webinars are recorded from a live event with a Q&A session for the attending audience. We hope you find this information useful and consider including our partners and their offerings in your life. Thank you for your interest in our content. This meeting and all materials presented today, including slides, audio, video, and chat content, are protected intellectual property of the hosting organization, the National Association of Nutrition Professionals, NANP. Recording, screen capturing, rebroadcasting, transcribing, or otherwise using any portion of this presentation is strictly prohibited without prior written permission. This includes the use of third-party platforms such as Webinar TV, as well as AI chatbots, AI note-taking tools, or any other artificial intelligence technologies. Unauthorized use of this content may result in immediate removal from the meeting and may subject the offending party to legal action. By remaining in this session, you acknowledge and agree to these terms. Thank you for your cooperation, and we appreciate your respect for our work.
Welcome to today's NANP webinar featuring the International Academy of Classical Homeopathy with Christina Horvath. I am your host, Tiffany Perry, Development Specialist for the NANP. These webinars are recorded and can be viewed by registrants. We will send you a link to this recording later in the week. We do ask that you would please hold your questions until the end, and then we'll be happy to go through them with a Q&A session. Before we begin, I'd like to share an important notice for all participants. This meeting, along with all materials presented today, including slides, audio, video, and chat content, is protected intellectual property of the hosting organization, the National Association of Nutrition Professionals, NANP. Recording, screen capturing, rebroadcasting, transcribing, or otherwise using any portion of this presentation is strictly prohibited without prior authorization and written permission. This includes the use of third-party platforms such as Webinar TV, AI chatbots, AI note-taking tools, or any other AI technologies. Unauthorized use of this content may result in immediate removal from the meeting and may be subject the offending party to legal action. By remaining in this session, you acknowledge and agree to these terms. Thank you so much for your cooperation, and we appreciate your respect for our work. Okay, let's get started. Today we present a case study of neurodermatitis and celiac disease treated with classical homeopathy. Christina completed her homeopathic education in Greece with Professor George Vitolkas and graduated from the International Academy of Classical Homeopathy. She is nationally certified in classical homeopathy in the United States. Christina has been practicing classical homeopathy for over 20 years, and she and her husband Dan have a homeopathic practice in Phoenix, Arizona, called Arizona Homeopathy. She is also the main instructor of the 3-year practitioner program at the International Academy of Classical Homeopathy. She works diligently with students to enrich their learning experience as she presents Professor Vitolka's lectures throughout the program. Welcome, Christina, and thank you so much for joining us today.
Thank you very much, Tiffany. And hello, everybody. So thank you for joining us today. I hope you find this case interesting. I want to show you a case that Professor George Vitolkas took years ago in Celle, Germany. And I also want to go through a brief introduction to homeopathy, which is not an easy task when you only have a few minutes. So I tried to just give you a little bit of information about homeopathy if you're not already familiar with it. And then we'll go right into the case. So in the interest of time, I'm going to start right away. So a little bit of the basic principles of homeopathy. Homeopathy is derived from the Greek words homeos, which means similar, and pathos, which means suffering or disease. And it was coined by its founder, a German physician Samuel Hahnemann, in the early 1800s. The main law on which homeopathy is based is the law of similar. similars, which means diseases are treated by remedies that can produce similar symptoms to those of the patient. An important idea introduced by Hahnemann, and which causes homeopathy to differ from conventional medicine, is individualizing. Maintain that there are no diseases, but only patients, and therefore a treatment must aim at treating the individual rather than the disease. According to this idea, 10 patients or clients, as we like to refer to them if we're not medical doctors, suffering from the same disease, for example, epilepsy, will probably each require a separate pharmaceutical substance unless the symptoms of 2 or 3 of them are identical, down to the last detail, a rare but not impossible situation. The symptoms that a remedy can produce are found through an experimental process called proving. The proving involves giving a substance to a group of healthy individuals of both sexes in increased dosages, though not beyond the toxic levels, and recording their symptoms over a designated period of time. The results of provings were recorded in the Materia Medica, and later homeopathic repertories were developed. Both Materia Medica and repertories are used in homeopathic practice. Homeopathic software programs were later developed to add in repertorization. Materia Medica is a reference guidebook which contains the descriptions of the homeopathic remedies and their therapeutic action. The information contained in the Materia Medica is derived from provings and also from clinical and toxicological data. The homeopathic repertory is an index or a library of symptoms, which we call rubrics, and the remedies which may produce these symptoms. Here is an example of a repertory rubric. In this, we see all the remedies that have desire for sweets. So there are 72 remedies that produce this symptom. The repertorization is a process, the potentization is a process of preparing the homeopathic remedy by repeated steps of dilution and succussion. Succussion meaning shaking or agitation. The potency is the specific strength of a homeopathic remedy determined by the number of serial dilutions and succussions. And examples of frequently used potencies are 6x, 12x, 6C, 12C, 30C, 200C, 1M, 10M, 50M, CM, and also LM or Q potencies. Now let's go into the case. This is a case of an 18-month-old boy with neurodermatitis and food sensitivities. The case was taken by Professor George Vithokas in Celle, Germany between April 1989 and July 1991. So you are going to see a young Professor Vithokas. Professor Vithokas is 93 right now. So you're going to see him at a much younger age back in Germany. The intake of this case is part of Professor Vithokas's The Celle Seminars book on the case number 10. In this session, you will see the original case taking and 3 follow-ups. So the original time of the duration of the case was over 2 hours. So for the sake of time, I shrunk it down to probably about 40 minutes. So you will not see the entire case taking. You will see the main points in the case taking and the analysis. If anyone is interested, there is a link to the Celle Seminars book. You can find it on the vithokas.com website. So a little bit of medical history of the boy. During pregnancy, the mother had many psychological problems. At birth, the umbilical cord was wrapped around the baby's neck. At 6 weeks old, neurodermatitis started on his forehead and between his eyebrows. At 5 months old, he started teething. At 6 months old, he stopped growing. And then after the BCG vaccine and the DTP, so BCG is Bacille calmette-guerin for tuberculosis, and the DTP is the diphtheria, pertussis, and tetanus vaccinations, the skin eruption spread all over his body. Between 14 and 18 months old, the boy had a total of 7 acutes, including colds and bronchitis. There were some remedies given previously. One of them was Natrium muriaticum 1M, which showed improvement for a short while. And then Natrium muriaticum 10M, there was first amelioration, then the skin got worse, then the feet became cold again, and he had strong aversion to bread. Pulsatilla 1M was given in January 89. There was amelioration for a week and then worse. And then he started wheezing when breathing. He also had aggravation from cold, damp air that aggravated the wheezing and the cough. Calcarea carbonica was given in low potency with no effect. And Dulcamara, LM6 and 30, that helped for a few days. And then the mother gave a cough syrup called Mucosolvan. So I want to show you the intake. And this is the original interview from April 1989. And this is about 4 minutes.
He is in a constant state of unhappiness. Nothing seems to cheer him up. Desire bananas and potatoes, 3 underlines. Aversion bread, 3 underlines, and apples. Feels better on the seaside. Skin is better too. His hands and feet are always cold. Wheezing on respiration. Skin eruption all over the body. He scratches himself until he bleeds.
When he scratches something terrible.
In bed, when he gets too warm, does he scratches?
Especially then.
Especially. They said after vaccination, what type of vaccination?
The tuberculosis and the triples.
Did she had any test about tuberculosis after that to see if she's sensitive? Does the baby grind his teeth in sleep?
Yes, he does.
Yeah. Very much.
Not while he's actually asleep. He does it actually during the day.
During the day?
Mm-hmm.
Has she seen the baby sleeping or the baby sleeps next to her?
Until a month ago, he slept in the same room with me, but not since then.
In the same room. There is discharge from the eczema, or it's mostly dry.
It sort of produces a bit of fluid all the time.
That fluid is sticky?
It's sticky, yes.
Sticky. And what's the color?
It dries on in a yellowish color, but when it actually oozes out, it's clear or transparent.
It's very sticky like honey? Mm-hmm.
Yeah.
As honey.
Where is the eruption except of the face?
Everywhere, except, strange enough, in the area where his nappies are.
Can we see? Let's see.
And his back and his abdomen.
Only where his nappies are?
Yes.
Can we see, can she address to see that? He's a very difficult child.
Yes.
Was anybody from the family, her family, or the family of the father that was suffering with tuberculosis?
Yes. It was the brother of my father who's had tuberculosis.
She herself, in the young age, she had any problems with pre-tubercular state?
My sister had diphtheria.
She
Otherwise,
herself is grinding her teeth in sleep.
no. My husband does.
Her husband does. Strongly?
Very much, yes.
Very well. Okay. And her husband is a difficult husband.
Schwierige Person oder ein schwieriger Ehemann. Ja, wir sind getrennt jetzt.
We live separately now. We're separated.
Not very calm, eh? He was not very calm.
Er war nicht so ruhig.
Nein.
No, he wasn't very calm.
Okay, so let's go to the analysis and then we'll go over the symptoms. So of course there were more symptoms that what I showed you, but I showed you the main points and I wanted you to see the skin eruption the way it looked at that time. So the analysis is going to be about 8 minutes.
This was a quick case. But with children, you usually are in a state where you cannot get very much information, either because the parents are not observant or because they have very few symptoms, but the symptoms they have usually are strong. Now, with neurodermatitis, children, you will always have some problems, because it seems that it's a disease of our time. It's a combination of allergic situations or whatever we do to our bodies, vaccinations, allergies, allergens, and the degeneration of our defenses. And they're quite strong, serious cases that can give you a hard time. The worst problem with these cases is that they can go into tremendous aggravations, the children. And you will have to be very patient and to understand also what has taken place, otherwise you will tend to aggravate more and more the situation. The child has some symptoms of the first thing we hear, honey-like discharge. Is which remedy? Graphitis. But is this graphitis child? Why is not graphitis? What do you expect to see in graphitis? In conjunction with his eruption, I mean. Graphitis, you will see not only the ears, but you see the lobes here. Eh? You see the bends with cracks. You expect to have around the lobe of the ear, where the bend is, you expect to find a lot of activity there. So you're not very happy with phytis. The child has a strong aversion to bread, and that's why Natum muriaticum most probably was prescribed, because Natum muriaticum has a strong aversion to bread. And the effect of Natum muriaticum, what is? It's a partial effect. The remedy is not the correct one. That's why it has a partial effect. It has it for a few days and then it goes away. This is a suppressive effect. In any case, in this case, what is the remedy? Which is the remedy? Medorinum, somebody said medorinum. If that was a case of medorinum because of amelioration in the sea, which has said where we would see the eruption mostly, exactly the place where he does not have it. That's quite strange. I mean, why should you go and give medorinum? There is no reason. We get some hints of tuberculinum from the very beginning. And then we like to know if there is a kind of trend within the family of tuberculosis. Because we get immediately that idea due to the fact that the mother has connected the state of the child with the vaccinations. Most probably the child was in a state of tuberculosis, and that state was aggravated very much by the BCG that was given. And we had this reaction. Why we say that? Most probably not only because of the family of the mother, but most probably of the father. There's a more tubercular streak in the father, especially when she describes in this way his character perhaps a little bit we got, and the main thing is the grinding of the tea in the night, in the father, which indicates most probably that we have quite strong tubercular tender. With then the confirmation, tuberculinum brings up the reaction. Then we have out of his symptoms, we have quite a few symptoms if you repertorize, which we give tuberculinum. We proceed, we give tuberculinum, a dose of 30 C, expecting an aggravation, maybe for a few days, expecting that maybe underneath we may see another remedy coming. I cannot at this moment tell in which direction the child will go after tuberculinum. It may be tuberculinum will take quite a lot away, and maybe we have to wait quite some time before we give the next remedy. I don't believe that it will clear the skin. You see, one thing you have to understand perhaps, something which never mind how much I repeat always, every one of us tends to make a mistake. Once you have a case like that, and he says, itching is better, a little bit better. Where is the most disturbing symptom? Is itching. See, the eruption does not care about the aesthetics. The itching is that disturbs. Itching is better, you wait. Itching is better, you wait. But the eruption stays. It doesn't matter, wait. But the eruption, no change. Doesn't matter, wait. You see, a little bit better. You see, month after month, the itching goes down, and slowly after a few months, you start seeing some changes in the skin. That is one of the reactions you may have. But if the mother says the itching, the eruption is the same, and then you tend to give another remedy, when you have a positive effect of the first remedy in such cases, you will tend to aggravate very fast. Very fast. These cases are sensitive to almost all remedies because you will find remedies which are quite close to the case. And then you give this and aggravates. And then you are in despair because you keep on aggravating. Since the remedy was the first one that you gave, the tuberculinum was correct, any other remedy will aggravate once it's not needed.
Hey, so I want to show you a repertorization, and some of you may not be familiar with this, but this is where we put all the symptoms that the child had in the language of the repertory. And of course, he had other symptoms that I did not show in the intake for the sake of time. So he was discontented, crying easily, grinding of teeth. He had distension of the abdomen, undigested stool, wheezing, cold extremities. He slept on his abdomen. The skin eruptions were discharging honey-like substance. The eczema, the itching aggravated in the warmth of bed. was scratching until he bled, undressing aggravated, and then some what we call modality, some symptoms based on his foods, desires, and aversions. So he had aversion to apples, desire for a banana, aversion to bread, desire for potatoes. There was also family history of tuberculosis, and he was aggravated by the C, ameliorated by the C. I'm sorry. So tuberculinum, if we use the software to solve all of these symptoms, we get the suggestion of tuberculinum first, then sulfur, bacillinum, medorrhinum, and graphite. So tuberculinum covered 10 out of 19 symptoms, and graphite covered 9 out of 19 symptoms. But professor decided with tuberculinum, because of the tuberculosis predisposition, also graphite has the eczema in different areas of the body. He said mainly about the ears, behind the ears, and also the eczema in graphite cracks, the skin cracks. You see the deep cracks in the skin, which we didn't see in this case. So the remedy was tuberculinum 30C, which is a low potency, 1 dose, because he wanted to avoid any unnecessary aggravation. There was a follow-up. He came back 3.5 months later in July of 1989. And I want to show you the intake and pay attention to the child and how he behaves now.
He got a fever. That's the third time in his life that he had a fever. After that, the skin got better. Not that some places were free of rash, but everywhere there was a little bit less rash. And the spots weren't so much infected with pus. He is a little bit more open. He got a little bit more open. He spoke a little bit more, and he was interested more in other things. That lasted for about 2 to 3 weeks. Then all of a sudden he had diarrhea.
I understood that he had diarrhea. Because of the diarrhea, I went to be examined, and then she was sent to the hospital.
After the diarrhea, the skin got worse, and she does not know whether it has to do with the hospital or with the diarrhea.
Yeah, in the hospital, did they give any medicine to the child?
No. They took blood. From June, middle of June until now, he slept all through the night for 3 weeks. And now, since 1 week, he does not sleep through the night again.
He wakes up and scratches
And screams,
and screams
cries.
and cries.
No, like now.
What does he attribute? There was any reason why he had the diarrhea? According to her, he ate something that brought the diarrhea. What?
She thinks it was a virus. She asked her friends, and more children.
Other children had the same.
Other children had the same.
The child has any changes? I mean, can she report any changes?
3 weeks he slept through the night. He is more open. He goes to friends. He laughs more.
He is still grinding his teeth, grinding his teeth.
No,
Not
not at
anymore.
all. She has not heard it anymore.
Is he more affected by heat? She thinks that real...
She cannot say that really. Sometimes it's okay in the heat, and when he looks the way he looks now, it is very bad. He does not like water anymore. He does not like to drink water at all.
Ice cream?
She never gave him ice cream because of the sugar.
So, yeah. So does he think that the remedy has helped the child? What does he think? Yeah, you explain first. You say?
When the skin is better,
Yeah,
the crying is better as well.
because...
With his emotional side, with the psyche, yes. With the skin, no, not at all.
Well, the fact that he was sleeping for 3 weeks, it was also before, can be.
That is extraordinary. That was never before.
He likes something cold to drink or something warm.
He prefers everything cold. He likes to eat cold things. His food has to be cold.
Okay, so just to recap the timeline in this case, he took tuberculinium 30C in April 89. Beginning of May, he had an acute with fever, the third fever in his life, and cough syrup was given for the cough. After the fever, the skin got better. He got more open and talked more. Then he had the acute with diarrhea, which the mother thinks was a virus. The mother went to the pediatrician. He took blood and investigated, and they found that all the blood tests were abnormal. Leukocytes were over 14,000, hemoglobin over 1,000. The pediatrician had to do the test again after 10 days because he couldn't believe the results, and the results were the same. He sent the mother to the university clinic in Frankfurt, and they were supposed to find out if it was genetic disease. They did an allergy test, and he is allergic to all wheat, rye, and oats, and they said he had celiac disease. And they wanted to take a biopsy from the small intestine, but the mother did not agree to that. After the diarrhea, the skin got worse, and then in the middle of June, until a week ago, he slept well for 3 weeks. 1 week ago, he started not sleeping through the night. He cried less until 2 to 3 days ago when he started to cry more. And from January to April, he had a total of 6 acutes, colds and bronchitis. And from April to July, he had only 2 acutes. So the itching with scratching until he bleeds, he still has desire for potatoes, desire for vegetables, aversion to bread. He will put bread in his mouth and spit it. That means the organism really doesn't want bread. And there is aggravation from bread. He prefers everything cold. He likes to eat cold things. And there is aversion to water. So these are a lot of food and drinks symptoms. And let's take a look at the analysis, which is about 8 minutes.
So what has happened? Now you have to make clear judgment of what has taken place. You gave a remedy and you have to decide, did it act? If it has acted, should you repeat it? If it has acted, should you wait? If it has acted, should you give another remedy? That now is the point. First question, has it acted? And how? Acted? Yes. One point that has acted is the fact that we see from April until July, he has only 2 colds instead of 7 that he had the first 4 months. January, February, March, and April, he has 7, 8 colds. where April, May, June, July has only 2 times, and the second time is very mild, just 2 days, and is gone. Therefore, the tendency to cold on which we had prescribed the tuberculinum has been reduced drastically. The second is, psychologically, the mother says is better, the child slept better for a period of time. Now, this is the point now. The last week is crying more, is scratching more, is more disturbed. The skin eruption is worse, and the child does not sleep anymore. Now, you go to your repertories, look at your repertories, and you have certain symptoms which are quite strong, and you can repertorize them. Could you project the symptoms that I took in repertorization? Itching, scratch until it bleeds, must scratch until it bleeds, desire for potatoes, aversion to bread, desire for vegetables, and desire for cold food. That's a very interesting case, very interesting, very didactic case, and you have to learn from such cases. These cases you will not see one day after day, because there are some things that are happening which I will tell you later on. So you look upon that, and you look in your repertories. Please tell me, what do you find? There is one more rubric that is not there. It has the clue. It has the clue of the case. But even with this, let us say you have not taken that rubric, and you have only taken these rubrics, and you have looked in your repertories, still with these rubrics, you should be able to point out something which is interesting. When this child was examined by the specialists' laboratory examinations, they found out that the child was very allergic to any kind of flour. Give me the repertorization without aggravation from bread. And he says, the remedy which is most probable is pulsatilla. So you got a hint from your repertorization. Then you go and look, he is very allergic to flour, which is bread. He has aversion bread, definitely. Therefore, we know that pulsatilla, who is an allergic person, is very allergic to what? To bread, to flour, wheat flour. Wheat flour. Is an allergic person who has an aversion. Why they have an aversion? Because this does not fit with their constitution. When you have already a repertorization that gives you a hint for a remedy, that you look upon the child and you say, now the child, what is this child? What the mother says, for a few days now, the last few days, he started crying, the child, and he has fits like the one that you have seen in front of you. And the child stays with the mother. And he cries. And you have aversion to bread. Take the bread, spits it. Well, his organism knows what he wants. The mother says, takes the bread, it's so important. Desires cold food again is, of course. What is your problem here? Not only you don't have a problem, but you have 100% assurance that this case 1 week ago stopped being tuberculinum and became pulsatilla. This is my assumption. This is how I put things logically. The boy slept better, etc. And now he goes away from sleeping better. The organism starts being upset again. How? In a particular way, which is the skin, etc. And now here is the big secret. Here is the big secret. Pulsatilla was given to the child 2 months ago, before the tuberculinum, and did nothing. Are you going now to give again pulsatilla? Yes. Yes, now you say yes, of course. But I don't know what you would do 1 week ago. I'll tell you, cases like that, they make sure whatever method. So you have to give tuberculinum first and then pulsatilla. There's no other way. Tuberculinum first and then pulsatilla.
I say the mother is real patient.
The mother is real patient.
Yeah.
She is also, you see, she is also common sense woman. I see she is not over excited. The child cries, right? She is not easily led. Oh, the child is very sick. Take him to the hospital, take him to the specialist. Do this, do that, and destroy the child. You see, the attitude of the mother helped a lot in this case, because I did not perceive anxiety and pressure, you see. Do something. Don't you see the child is crying, he can't sleep, and then your mind goes confused and you give anything.
Okay, so in this case, the attitude of the mother was good because she didn't panic. So the repertorization, you see how many food desires and aversions were, how the prescription was based on the food desires and aversions. I only took one rubric about the skin itching. And this shows pulsatilla, followed by natrium muriaticum. And here pulsatilla covered 6 out of the 7 symptoms. The only one not covered was the desire for vegetables. And we see pulsatilla very strong. So if we see something in red, that means it's strongest symptom, strongest remedy. Under desire for cold foods, also pulsatilla is very strong under aggravation from bread. And also desire for potatoes. We only have 7 remedies and pulsatilla is one of them. So in this case, professor again gave a dose of pulsatilla 30C, again low, to avoid any aggravation. And then they came back 8 months later.
In July last year, he got pulsatilla 30. After this 1 week, he felt very good. And then the next week was very bad. He had bronchitis and the skin was worse. And then it started to get better again. For 3 weeks, it was better. In September, she phoned you and we gave pulsatilla 200. And then the grandmother went with the child to a child examination we have in Germany. And then the doctor said, we have to make some vaccinations. And the grandma told this doctor, the mother does not like to have vaccination. And then the doctor asked the grandma whether she wants to take the responsibility if this child is not vaccinated. Because they wanted to go with the child to Israel, and it would be too much of danger, no, to go.
What kind of vaccination? The triple.
Yeah. Afterwards, the whole situation was very
But the doctors did not know that the child is allergic, and still
Yes.
he wanted to give vaccination.
Yes, this is usual in Germany. Yes, afterwards he felt very bad. And then I phoned you another time and repeated pulsatilla in October. In the end of October, he went to Israel for a few weeks There he felt much better. The skin was much better. And he started to grow. 9 months he did not grow at all before. He started to talk and to play with other children and to love.
Yeah, focus on the feet, the right feet, which is the worst. Yeah. Okay. Then, very good. Tell him to turn back. Very good. Very good. Yeah. Yeah. That's okay. It's all right. Yeah. What he was asking to eat?
Ja, seine Flasche.
He wanted to have his bottle. Was ist da drin?
The bottle is outside. Yeah, see. He wants the bottle.
Oh,
What I want to ask is whether this condition now is the best that she was ever, or there was a period where she was even better.
in Israel he had no eruption at all.
In the face, nothing? Nothing. How long they stayed in Israel?
6 weeks,
6
6
weeks.
Wochen.
And the climate was, how was the climate at that moment? It was dry or humid or?
It was very dry climate.
How long after they had been to Israel, how long after he started improving?
4 days.
4 days. And in 4 days, everything disappeared.
No, it went very slowly, and day by day she went into the sun more and more with him, and then the skin was better.
Now, when they left Israel, the skin, before they leave Israel, the skin has started already relapsing.
Yes, on the last day of their holidays in Israel, it started,
It started
again. It started
coming back.
again.
Mhm. In the face. Yeah.
She said that he got the last pulsatilla dose shortly before they went to Israel.
Oh, I see. Does he cry a lot, or now it's normal?
No, not anymore.
Not anymore.
Okay, so let's go through a recap of the timeline. He had an aggravation after pulsatilla, amelioration until September. Pulsatilla was repeated in September. Then afterwards, he had the vaccination followed by aggravation, pulsatilla repeated again. And then the skin ameliorated while on vacation. He started to grow, to talk, and play with other children. Skin symptoms started coming back early January, the last days before they left Israel. And the first 3 weeks after they returned from vacation, the skin got worse, then suddenly stopped and now continues to get better. The skin is better now than a month ago. In January, he developed another bronchitis and took cough medicine. And yesterday also, he had bronchitis and the mother gave cough syrup. He still loves potatoes. He's still allergic to wheat, to milk, and nuts. He has a good appetite. He's domineering and obstinate. Those were the main symptoms. And let's watch the analysis. Okay.
Concerning vaccination, you see, what I know, from what I know, the authorities, the doctors who work for vaccination, and the authorities are very careful not to vaccinate when there are allergic predispositions. Now, how is that fits with this case? Yeah, but how they did not take into consideration that? What I'm trying to find out is whether there is an effect of the climate upon the child. The child got a dose of pulsatilla beginning of October, and in 15 days they left for Israel. The child was totally free while he was in Israel, and has anything to do with the climate and what kind of climate maybe is good for the child. And I'm trying to find out that. Well, yes?
Yes, on the last day of their holidays in Israel, it
You see, it
started again. It
coming
started
back.
again.
If it was really the climate, the aggravations start 4 or 5 days after they return. It is an amelioration which takes place, and it is a natural relapse which starts after. It's not a relapse yet, but it is a kind of natural relapse which starts. And what we see here is the child after having the bronchitis and the mucosolvan, and again bronchitis and again dose of mucosolvan. Still, the condition in which the child is does not require a remedy.
Diese
Huh?
Aktion,
You don't give a remedy, eh? It's very dangerous to give the remedy at this moment. And what I found out is that still is on a pulsatilla state. Most probably, the next time he will get a pulsatilla. There is a time when he will go away from pulsatilla. That layer will go away, and another remedy will be underneath, which will not bring again, if it is given, pulsatilla as a relapse. But at this moment, the child is on a pulsatilla, still on a pulsatilla state. So you see, we gave already 3 times pulsatilla. We went from 30 to 200. Still, the child is on a pulsatilla state, which means that next time he's going to have a relapse, pulsatilla is going to help him again. So we know that, and we are secure. The child is feeding well, is eating well, is growing, is mentally is okay, is not suffering. Why you should give a remedy? You don't have the reason to give it. What you can still say about the child is that definitely on the mental level, he's gone away from pulsatilla. There are no symptoms anymore on the mental level of pulsatilla. He's quite healthy now on the mental, emotional level. And the pulsatilla symptoms, if we have any, and we have the sensitivities and the allergies, they are on the physical level.
Okay, so these are the symptoms he had and the proposed remedy, pulsatilla. And again, pulsatilla covered 4 of 7 symptoms, and no remedy was given. So the last follow-up, this is 15 months later. Let's take a look. This is about 2 minutes.
Beginning of February, he got a strong spell of pertussis again with apneic phases, and the skin was aggravated again, especially in the face, bends of his elbows, hand joints, and also the calves and the bends of his knee joints. Then he got Kalisulf 200 after I called you on the phone. After Kalisulfuricum, he got very moody, the skin got better, and the cough had gone. Disappeared. Until April, May. April, May, a strong sort of cough started again with bronchitis. In the end of May, they gave mucosolvan, and then 14 days later, his cough had disappeared. Yeah. Now it is again that on exertion, he has a little bit of rattling again.
Everything. Now he perspires, still in bed.
Yes.
A lot. Around.
Yes. Completely wet around his,
Really wet.
around the border of his hair.
Around the border. Is he affected by the warmth or cold? And
Yes. He loves more the cold than the heat.
is he? How is his character? I mean,
Lovable. And the practitioner adds, If he does what mother wants, then if mother does what he wants, then he's all right.
Yeah. So is he affectionate? Shows affection a lot?
Sehr liebenswert? Zeigt eine Menge Zuneigung und Liebe? Ja.
Yes.
And he needs affection also.
Und braucht auch sehr viel Zuwendung und Zuneigung. Ja.
Yes.
Okay, does he has any eruption on his body now? Can you just, yes, just lift a little bit.
Hände hoch.
Yeah. Almost nothing. Yeah. This back? Yeah. Nicht. Good. Gelatinous eruption.
Okay, so the main symptoms here, he didn't like milk, aggravation from milk, weak, cold perspiration, margins of the hair, liked the cold more than the heat, rattling after exertion, desire for butter, milk, desire for butter, meat, and salt, and potatoes and vegetables. So for the sake of time, we're going to skip the analysis, but no remedy. These are the symptoms repertorized, and no remedy was given at this time. And although pulsatilla still showed as the first remedy, and if we know pulsatilla is an affectionate, warm child, and symptoms covered by pulsatilla, and no remedy was given. So I wanted to just give you some important takeaways. The remedies are indicated in a specific order. In this case, pulsatilla was given before tuberculinum, and it didn't act, actually made the child worse. Because the tuberculinum layer was on top, it had to be removed before pulsatilla could act. And if the itching is better in a skin eruption, we have to wait. Giving another remedy would only aggravate the symptoms. And sometimes if there is aggravation, but the whole person is aggravated and there's no amelioration on a deeper level, that means it's not a good homeopathic aggravation. Once we see the inside getting better and the outside getting worse, then we can wait. If we see the opposite, that means we're stimulating, not with a curative reaction, we just stimulate the organism. And the food desires and aversions are very important in selecting the homeopathic remedy, especially in children. Children don't intellectualize their food cravings and aversions as much as adults, and we can really count on these symptoms. So in this case, the remedies were decided a lot on the food desires and aversions. So we see how important that is in a child. And he still has the sensitivity to wheat, but in time with proper treatment, that may go away also. But I think that was an impressive improvement in the neurodermatitis. So that's it for me. Anybody has any questions?
Let me check here and see if we have any in the Q&A box. I don't see anything that's listed here in the Q&A box.
Okay. Here. Well, thank you. Sorry, I went a little too fast, but there was a lot of material I wanted to show you today. So I hope everybody enjoyed the case, and thank you for attending.
Well, thank you so much, Christina,
for
for joining us today. And Christy Hall would like to also say thank you for being here today and presenting this information. Chelsea also says thank you so much. Great presentation. We appreciate you being here and sharing this case study with us. It was very informative.
Thank you very much, Tiffany. And
You have a great day.
You too. Bye-bye.
Okay, bye.
The information presented in this webinar is for educational purposes only. Please note that holistic nutrition professionals do not diagnose, prevent, treat, cure, prescribe, manage, or heal diseases or medical conditions. They are also not licensed in any state and work with clients, not patients. There are no continuing education credits associated with this webinar.